kinesiology and health. He received his bachelor science degree from George Washington University, and then master and a PhD degree from University of Connecticut. And most recently completed a postdoc appointment at University of Arkansas. He also spent time as a research assistant at Naval Health Research Center, assisting with warfighter readiness and thermoregulatory safety during training. Currently, his research focused on physiological effects of increased and decreased water intake, interventions to assist with exercise in the heat, as well as the individual and the combined impacts of water intake, heat, and exercise intensity on renal function. He has published 39 peer-reviewed journal articles in these areas and 4 book chapters. Let's welcome Dr. Johnson.
All right, guys. Well, thank you, everybody, for coming out today. This is a hard act to follow. We just went really far into the cells, looking at individual markers from cellular stuff. And now we're going to zoom all the way out and talk about whole people. Not only are we going to, so the measurements that they were just taking the previous studies that we looked at are cellular. We're looking at P now. Okay? So get yourself ready. I feel like we're taking a step back as far as complexity, but hopefully we're going to get some information you can use. Okay? So we'll start with the importance of water intake. And we all know, and I classically ask these questions of people, what does hydration mean? Why is it important? And everybody says, well, you need to be hydrated. And then I go, why? Well, it's good for you. It's good for your skin. But there's actually some disease risks that are associated with it. So I want to go over those. So you have increased water intake, or what I like to say is avoidance of very low water intake. And we know that reduces our risk of developing chronic kidney disease overall. Also, risk of kidney stone. Our highest amount of evidence has to do with the recurrence. So if you know somebody who's had one kidney stone, if they increase their water intake, their likelihood of getting another one goes way down. And lastly, there's some evidence that I've been involved with looking at hyperglycemia. So you drink a little bit more water, you're able to process glucose in a little bit better way. Okay? So if we do a quick Google search on how to tell if you're dehydrated, these are some of the symptoms that come up. And that's exactly what I did. I put them up here in order, and I said, okay, of these, which can we sense on a normal basis? So Caleb, how's your blood pressure right now? Is it low?
Pretty well, I would say.
Pretty good?
Yeah.
I think the most people out here don't really know what their blood pressure is right now. You might say if it gets really low, you get a little lightheaded, and you can actually tell about that. But overall, we're not going to be able to tell if our blood pressure changes on a day-to-day basis. Headaches, yes, headaches can be associated with dehydration, but there's a number of other things as well. I mean, today's Friday. I'm sure some of you in the audience may have woken up with a headache this morning. Okay? Dizziness, same thing. There's a number of factors with us being at altitude here. Most of us have had a friend come in from out of town, and they're walking around being dizzy. That doesn't necessarily mean that they're dehydrated. Muscle fatigue as well. How do you classify that between a workout and water intake? A lot of these as well. Feeling lethargic. The last 3 here are the ones I kind of want to focus on. If you have a dry mouth, if you are thirsty, and if you notice a lack of urine, those are some of the risk factors or symptoms that everybody in this audience can kind of start to use to understand, am I dehydrated? Do I need to consume a little bit more water? Okay? So, method number 1, how to determine if you are dehydrated. We're going to make it pretty easy. Are you drinking the recommended amount of water per day? And before I put this up here, I'm sure that a lot of people didn't really know, okay, what's the record? 8 glasses a day is what you. But we're going to actually make it a little bit more exact, and we're saying, okay, for men and women, the total volumes are 3.7 and 2.7. Now, what we do from that is we take about 80% of that amount of water, and we say that has to come from your drinks or your beverages. Okay? So we have our volumes here in liters, and then if you think about it in terms of ounces, there we are right there. So that's going to be, 3 liters a day. That's a large amount. And you guys are thinking, okay, yeah, duh. But what we have to do now, we'll go on in a little bit, and we're going to talk about some myths that are related to that intake. Because this is not just plain water. We're going to move on. So we've done a study that's related to this, and this is specific to kids, but we can extrapolate these results to adults as well. And what we're trying to do here is say, okay, is water intake related to urinary hydration biomarkers specifically in children? And if we look, the IOM, that means Institute of Medicine. So that's a group who comes up with our recommended intakes. And then in the European front, you have your European Food Safety Authority. And they're doing the same thing for European residents. And if we look, here's our TWI, which is a total water intake, and from fluids, that's 80% of those amounts. So those are our basic guidelines, and you can see that they're a little bit lower in the European Food Safety account. Now, what we do here is we say, okay, well, let's take a group of boys and girls, so these are our children the ages of 9 to 13 years old, and if we split them up based on their ability to meet that, based on their fluid records between boys and girls who met or did not meet these recommendations, do we see differences in their urinary concentration overall? And yes, we do. Especially for boys. You can see for females, we're not seeing quite the same difference. Yes, we see a difference in their amount of water that they take in, but their urinary concentration is not necessarily different, whereas with boys, you do see that. Okay? So overall, what this tells us is this is a relative risk plot right now. And if you focus on the top portion up here, this is all boys and girls combined, and we see that the relative risk for having a urine concentration over 800 milliosmoles, which is one of our cutoffs for dehydration, your relative risk for if you meet the IOM is about 2 times higher if you don't drink enough. Same thing with the EFSA. So we can see that that is a significant increased risk of being dehydrated if you do not meet the guidelines. So it's pretty simple now. All I'm saying that if you meet the guidelines and if you drink enough water, chances of you being dehydrated go way down, or they're about half as much. Okay? Really easy way. So here's a little myth buster for you. Is caffeine a diuretic? Who wants to answer this question for me? Taylor, you can't. You're in my class. I already talked about this in class last semester. Martin, what do you say?
Yeah.
You say yeah. Okay, yeah. I have my venti Starbucks in the morning, and then I really have to pee after I have that. Okay? Well, let's look at some of the data. Have you guys heard of meta-analyses before? Basically, this is where they take a bunch of studies that have been done on the same topic, and they smash all the results together, and they say, if we combine these results and can correct for some of the differences between the studies, do we find an overall result based on the number of studies that we see here? And so each one of these little boxes has to do with one study that involves giving a person caffeine and measuring the amount of water that goes out of them after that period. And if this is to the right of this 0 line right here, that means it favors diuresis. And if the little lines cross the 0, that means it's not significantly in favor. And you can see that there's only 2 studies up here that significantly favor diuresis. So, overall, what does this mean? Well, we go to our little diamond here at the bottom, and that shows, okay, yeah, that's to the right. So, yes, but the effect size is very small. It's equivalent of about an extra 100 mLs of water. And I'm going to borrow Alfonso your water. So that's about that much extra water right there on the bottom. So not even 1 water bottle worth. So is caffeine a diuretic? Yes, but it's not going to be a huge one. And they showed with this study as well, we didn't talk about it, but during exercise, it is not a diuretic. You're not going to lose more if you consume caffeine before a race or an event. And that's really important because we know caffeine is one of the most potent legal ergogenic aids out there. Okay. Number 2. So we took care of number 1. You got to make sure you're drinking enough water. Number 2, look at your pee. Okay. Here we go. So what are you going to do? You're just going to look at your pee. It's not as simple as just going to, down to Big Hollow Co-op or anything like that. No, you actually have to use a urine color chart to be able to determine if you are hydrated or not. And you guys have heard of this as well before, right? Logan, do you guys have anything like this in the locker room? You do, right? And it talks about the importance of being well hydrated and looking at that. This is a number of things. A lot of sports teams use this because they know the benefits overall. But so we wanted to look at this to see in a past study with urine color and the scale. Once again, it's in those same children that we were talking about before, but we can extrapolate this. So we want to see if we can predict a person's urine osmolality based on their urine color. And the first thing you have to do when you're doing that is you have to look at the relationship between those 2 variables. does urine color actually predict concentration of urine? And you can see that as we go from urine color 1, 2, 3, 4, and on the way up, we can see the mean line in here goes up. So we see a significant relationship. So that's step 1. Step 2 is we do something called a ROC analysis, or receiver operating characteristic. So this is a statistical technique that looks at your false positive rate. So basically, based on our measurement, based on urine color, we would say a person's dehydrated, and that wouldn't necessarily be true. So that's a false positive. Versus our true positive rate, which would be using our measurement, we predict that they're dehydrated, and they actually are. So what we're trying to find here is we're trying to find the optimal point where our false positive rate is really low and our true positive rate is really high. So where do those two things mesh up so we get the best relationship between those? And that's the point we're looking for with this type of analysis. So we did that with our group, and we have our lab urine color, and we also did a self-urine color assessment. So we had the students who were involved in this study actually take their urine samples and look at it and give a color. So if we look at them overall, we had them do it in the morning, the AM, and at noon. And we see our threshold was 4. So based on their self-assessment of urine color, if they picked a urine color under 4 or below, they were well hydrated. If they picked above 4, meaning 5, 6, or 7, that means they were dehydrated. And if we look at our area under the curve, our sensitivity and our specificity, we can see that specificity goes down with that AM point, but the noon point is pretty good. Same thing if we look at our comparison to 24-hour overall. So what we're showing here is that these kids who are 9 to 13 years old on their own are able to effectively look at their urine color and be able to tell if they are dehydrated or not. And that's important because we're thinking that, okay, well, for some things, most things, adults are going to have the same capability, if not a little bit better than 9 to 13-year-olds to look at a color and tell if it matches a chart. Okay, so a simple assessment. So some practical complications that are involved with looking at urine color. I'm sure a lot of you guys are kind of running this through your brain right now, like, what the heck? How am I going to do this? Okay, so yeah, have a look at the urine color chart first. We showed one up there. You can see them online. There's a couple out there, and I would recommend one of the 8-shade color charts. Next, look serially, meaning look over the course of days and weeks, and look for large changes overall. That's what you're going to be looking for. Don't just look at it once and be able to tell. You got to be able to evaluate it a couple times. For guys, this is pretty easy. Look at your stream, and you'll be able to tell on a chronic basis if it's darker or lighter. For women, it's a little bit harder. Okay, and this gets into some of the comments that we've had to do with our self-assessment studies in the past. What you want to do here is just look afterwards, and you want to kind of account for the size of the bowl overall. I know it's a weird kind of thing to be talking about, but you will notice over the course of days if you're doing this, if that is getting darker or lighter. And that's going to be able to help you evaluate your hydration level overall. Okay? And then you want to specifically look around lunchtime. That's what we just showed in the previous one, that those lunchtime urinations are more predictive overall of your 24-hour hydration state. So first thing in the morning, you haven't had any water for the last 8, 9, 10 hours, depending on how long you sleep, your urine concentration then is obviously going to be a little bit darker than it will be during the rest of the day. Okay? I want to stop here. Do you guys have any questions so far? Okay, we're getting through a lot of kind of my older research that I did during my postdoc, and now we're going to start to move in to some of the new stuff. So, number 1, you want to do your best to meet the water intake guidelines. Number 2, look at your urine color every once in a while. Now, what happens if for some reason you find your urine color really dark? You're doing your best to take in the right amount of water on a daily basis. You're checking your urine color, but maybe you were out for a hike all day the day before, and you get back and you're like, oh my gosh, my urine color is really dark. What do? Don't freak out. Don't do what everybody thinks you're going to do and just freak out. Okay? What you have to do is do a study about it. Figure out what you're going to do. So that's what we did when we first got here. And in association with Dr. Larson Meyer over from Nutritional Sciences, we did a really large study looking, okay, what happens after you're dehydrated? Well, Okay, so we took some participants, and during the first week, we had them here over 2 weeks. We gave them informed consent. We did a bunch of baseline measurements. Who are you? How much do you weigh? How tall are you? What's your baseline hydration status? Then we had them do a 24-hour urine collection when they were drinking the normal amount of fluid that they would normally intake. We're not changing anything yet. Okay? Week 2, we did fluid restriction on Monday through Wednesday. On these days, we only gave them 1 liter of water. Okay? Casey, you had a water bottle here. I want to show this to everybody. Perfect. That's probably more than, this is like 1.5 liters. So less than this amount of water per day for 3 days. That's it. Then on Thursday, we did a fluid intervention where we gave them more. And I'm going to show you exactly what volumes we gave them in different groups in a minute. And then we had them return some 24-hour urine collections they took in this period afterwards, and we wanted to see, okay, what happened. So we had a bunch of different groups, and we looked at them during water restriction, and then what's their water increase. So our group A had 1 liter during that time period, 1 to 3, and then they stayed at 1 liter. They were our control group. We had 25 people in that group. And then our group B, they got an extra ½ liter on that 4th day. We got a group that got an extra 1.5 liters, and our last group got an extra 2.25 liters. So we kind of progressively increased, and we wanted to say, with each progression, do we see more of a change on that 4th day after we've dehydrated these people over 3 days? Well, these are the people who were included. It's not important the numbers that are up there. All you want to focus on up here is these p-values, and what we show here is our groups were equivalent when we started the study. No group was heavier or no group was taller. All the groups had the same physiological characteristics beforehand, and that's good because we're giving them different interventions. We want to make sure that they start the same. Okay? Well, what happened? All right, here's the water intake over the course of days. This was their normal to start. These are our different groups, and we see that, oh, when we take water away, guess what? Oh, their water intake goes down. Duh. Okay, and we can see that there's no differences between our groups. Yes, it went down, and there was no interactions between the groups. That tells us that all the groups had their water intake decrease the same, and that's good. Okay, what happened? Well, urine osmolality, which is that measurement of urine concentration overall, well, that goes up. Just like the water intake goes down, the urine osmolality or concentration goes up. Okay. Then we did our water intervention. Okay, so from the end of the fluid restriction to the water intervention, what happened? And you can see this nice fan shape here. And this is exactly what we wanted to see, and that their water intake, this not estimated marginal means, went up. And you can see group E was our group that got the most extra water, and their water intake went up the most. So this is just confirming that our intervention worked. And then same thing, we have the inverse reaction as far as urine concentration is concerned. We see that the groups that got the most water, their urine concentration went down the most. Okay? And this is kind of one of those things. It's like, all right, give me my Nobel Prize, please. Like, thank you very much. You guys are all sitting there thinking, yeah, you gave more water, their pee got lighter. Duh. Like, I know that was going to happen. So let's get a little bit further into it. Let's make some cool graphs here and be able to make some eventual decisions based on this. So if we have our groups right here, this is telling us how much in the frequency of the urine color changes. And what we can see here is that in our group A, who remain the same, we have a lot of people in these red areas. And what those red areas mean is their urine color went up 2, 1, stayed the same, or maybe went down 1 shade in that next day. So if you keep your water intake the same, your urine concentration not going to change. But if you're in that group E, look at this. We have people whose urine shade is going down -4 colors. So maybe they were a 7 to start, and they got 4 shades lighter because of the increased water intake. And this is what it's starting to say. And now you can say, okay, well, each of these groups is associated with a volume of fluid. And now we can start to quantify. So the last thing we want to do is say, okay, what's the volume of fluid that's associated with moving from a urine color above 4, which is, kind of classically associated with being dehydrated, to less than 4. So we want to see who this intervention works for. We saw that 84 of the 115 people that ended up in the final sample had a urine color greater than 4 at the end of the fluid restriction. So you take water away. Some people still have a urine color that's really low, and that's good, and it's probably because their caloric intake is pretty low and their physical activity level is pretty low. Okay? Of those 84, the intervention was successful in lowering urine color in 26 of them. Okay, so if you look at those 84 people that were in all 5 groups now, the intervention worked on 26. Now, 19 of those 26 people, or 73%, were in Group D or Group E. So those are the groups that got the most water change overall. So what does that mean? Well, now we can look at the actual mean values of what they came in with and say, okay, of those 26 people, what do we have as a difference? And what we saw was the group that was successful, so yes, the intervention worked, their average fluid intake was about 1,500 mLs, the increase in fluid intake. In the group that didn't, well, their average was only about 764 mLs increase. And there was a significant difference between the two of these. So what this tells us overall, we'll go to that one in a minute, is that if you realize that you have a high urine color or high urine concentration, then in the next 24 hours, if you increase by about 1.5 liters or 1,500 mLs, you have a high likelihood of returning to a euhydrated state. So, I mean, that was the whole purpose of this talk. We've given you some ways now to identify if you are dehydrated and monitor your water intake and your urine color. And if you should, for some reason, get dehydrated, maybe, I don't want to say it, but maybe you exercise, all right, and your urine color goes up, maybe after that you might want to increase your water intake, all right? So the take-home messages here, knowing how much water you drink and checking your urine color are great ways to check. And then if you are dehydrated, you might want to increase your water intake by about 1.5 liters, and that's over the course of the next day. Don't think, oh, my urine color is dark, I'm going to chug 1.5 liters right now. Because what happens when you do that, you have a reflex that's called your oral pharyngeal reflex that happens in the back of your throat and down your pharynx, and that's going to feed forward and make you start peeing really soon, more than you normally would. Okay? So you want to make sure you spread that out over the course of the next 24 hours, especially with food. And that's about it for some of my past research and some of my current research right now. So I'd be happy to answer any questions. Wow. What do you think, Straight?
So, this the cumulative urine, it's not one particular time point, 24-hour point. The color of the urine.
Yes.
The reason I'm asking is, the antidiuretic hormone levels changes and your volume of urine changes accordingly based on your osmolality of the blood.
Yes.
So, are you taking that into account? So, is this color measurement done on urine collected over a period of 24 hours, or is it at one time point?
We have both. And I've only presented the 24-hour urine color right here. And the question that he's asking is this dependent on the time of day? Is this based on your AVP concentration, or is this your overall? And what this is so we did the individual samples. We had 6 samples throughout the day, and then we combined them all at the end. And what we see, the really interesting thing, is that the groups that got the very low amounts of water, the increase, so about the group that got, obviously the control that stayed at 1 liter, the 1.5, and even the 2-liter group, you saw very little fluctuation throughout the day with their urine concentration. With the groups that got the larger amounts, you saw kind of a zigzag pattern throughout the day with them. In the morning, their urine concentration would be a little higher, and then it would go down, and then back up throughout the day.
Would it have helped if you use the same group for different, rather than using different groups, you would have used...
Right, so did more of a kind of a crossover design instead of independent groups design? Well, we powered this for independent groups. So that's why we had 25 people per group. The other thing that's taken into account, I showed that one slide that showed their demographics being similar. Their fluid intakes were also exactly the same between groups as well. So we didn't have one group that was chronically drinking like 2 liters a day versus another group that was chronically drinking about 1. They all had the same water intakes to start. So you might be able to show with the people a little bit better if you gave them, each of the individual interventions for the same people. But like I said, we powered it for that. Well, yeah.
So I'm thinking of a clinical application. I'm a clinician. Elderly patients, huge issue because they get dehydrated, dizzy, they fall, they end up in the emergency room IV. They want to drink more. A, they lose the ability for thirst.
Yep.
B, they're on a lot of chronic meds, so to go by color of urine really isn't relevant. So how do you help elderly folks? Because, yeah, they come out of the ER and they're motivated to drink.
Right.
And then that motivation over time goes away because they have no thirst and they really can't monitor urine.
Yep. And also sometimes you find lower mobility rates.
Correct.
So the kind of the trouble with having to go to the restroom multiple times a day increases their likelihood to not drink more.
Right.
I think the number one thing would be to just look at volume overall, because generally these are not going to be a population that's losing a lot of body water through sweat loss. Yeah. So I think the volume is the way to go. And there's a number of different interventions out there that help people know exactly what they're taking in. Because I'm sure that probably about 80% of the audience right now doesn't know what volume of fluid they take in per day. So just teaching them the essentials of, okay, you know, I've had this much water to take before, or if you use some cups that are consistent to their living space and say, okay, you gotta have 6 or 7 of these per day, 3 in the morning, 3 in the middle of the day, 3 in the afternoon. Those sorts of educational interventions are going to be more beneficial for that population. Yeah, and that brings up another really good point. Anybody ever taken like a multivitamin or a B vitamin before? Yeah. What's your name again?
Heather.
Heather. What happens to your urine color when you take some of those?
Gets a lot more yellow.
Looks like you ate a highlighter, right? Okay, and there have been some studies out there that really show that, and it's actually conflicting evidence. Some show that you do have a change in urine color and other ones don't. So those are types of things that could happen with that. Also, maybe if you go out and have a nice arugula, goat cheese, and beet salad, that's going to change your urine color as well. Okay, so knowing overall the volume of fluid you take per day is going to be important. Yeah, Arthur.
So since you mentioned thirst is one of the 3 symptoms commonly used to judge dehydration, so is there any study looking at the threshold of insufficient water intake correlated to the perception of thirst?
That's a great question. So, Dr. Zhu's question is, we have thirst scales out there just like we have urine color. And you can say, okay, are you moderately thirsty, a little bit thirstier, or very, very thirsty? And the problem with that is I'm sure all of you know people who you barely see drink, right? Do you think that person is more thirsty than your friend who drinks all the time? No. And it's really interesting. We look at this and we have our groups that we've classified now as high drinkers and low drinkers. People who drink chronically under 1.5 liters per day. It's about 10% of the population who do that right now. Their thirst level is not higher than anybody else. So it's really hard to say, can you classify that? Because what happens is everybody's thirst kind of centers around that, kind of a little bit thirsty throughout the day, and it's independent of how much they're drinking. So it's really hard to do that. Basically what you would want to do is say, does that thirst change? And as that change happens, then that's when you're going to see an increase for fluid intake.
Do we use a normalized procedure? Because there's an individual difference, right? But is there any way we can normalize that?
Well, the hard thing there is we don't know right now if the people who chronically drink very low amounts of water, if they're dehydrated. And that's a study I'm actually working on right now with some collaborators from Arkansas. We know that people who drink more produce larger volumes of dilute urine during the day. But we don't know if people who drink less have shrunken total body water. Okay? All we know is that they pee less and it's more concentrated. So now we're trying to figure out, is there actually a benefit to drinking more in terms of expanding your total body water, and are there benefits associated with that? So we don't know how to normalize it quite yet. It's a great question, though. Did you have a question?
Do you see a difference in antidiuretic hormone or the activation of the RAS?
Absolutely. Yep, we do. So a couple of the hormones that are related to that are going to be your AVP. That's like Dr. Nair was just saying a minute ago, when your blood concentration goes up, if you are a low drinker, you're going to see a small difference in your plasma osmolality. That's sensed in your hypothalamus, which is going to kick out a bunch of AVP. It's going to go down to your kidneys and cause you to retain more water over the course of the day. And we do, if we compare high drinkers to low drinkers, we see a significant difference in that. We also see difference in cortisol, which is a stress hormone. And that's how we've related fluid intake to glucose regulation, because cortisol can actually impact your glucose regulation overall. Yeah, Hunter.
Is there any research on like the fluctuation, like if you drink a lot when you get really thirsty and you don't, or if you are a consistent drinker and not like the consequences of those?
Well, the difference there is going to be not necessarily over the course of days or weeks. It has to do with fluid retention. If you drink a lot and then don't drink for a long time, you're going to lose a greater percentage of that. You're going to get more fluid retention if you space it out evenly throughout the day. Yeah.
Have you detected some precipitations in urine which can be harmful to the kidney?
So that's a great question. We've looked about that for like aquaporin casts or some things like that are related to the actual aquaporin channels, but we haven't done any urospectroscopy to look at the urine concentration and what's in the urine, for example. But we see with those the kidney studies or the kidney stone studies, those are the studies that have looked at that, and they have seen an increase in the concentration of the casts that are associated, like oxaloacetate and those sorts of things. So the precursors for kidney stones. What else would you look for? I'm interested. Just those?
Yeah.
Okay, cool. I want to end there because I know my students a lot of them have to go across campus.
Sure. Yeah. Thank you.
Thank you.
Just please note.